Hello everyone, we are from the team Iconics and our product is LifeBubble. So our device revolutionizes the umbilical catheter protection and securement to improve the safety for neonates in intensive care settings. It is a dome-like structure that's placed around the stump to secure the catheters. Our device belongs to class 2 for the following reason. Spinal tap test. There's a very small possibility of severe complications following the spinal tap, including infection, bleeding, numbness. And hot air sterilizer utilizes the radiating dry heat for sterilization and high temperatures. Our predicate device is angioplast, in which the umbilical cord is cut off, and the healthcare provider can find these blood vessels. These catheters are placed in the blood vessel and X-ray is taken to determine the final position. Oxford creativity. So the function of the catheter is to avoid contamination, and it is available by doing sterilization, which removes the all forms of life and other agents on the specific surface. And the hot air sterilizer prevents contamination by utilizing the radiating dry heat. So thermal energy is converted to chemical energy here. Performance requirements. First one is functional. Insertion of the small guide wire through the catheter into the vessel lumen will help to guide the catheter in the vessel. The second requirement is safety, for which we are using protective glasses and masks. Third requirement is usability, for which the documented expectation and specifications designed to ensure that the device is easy to use. And the user interface meets the physical and cognitive needs of the patient and other stakeholders. So, clinical workflow. The first one that is done during the product use is that we are using the catheters based on the infant's body weight, and we are attaching the normal saline and syringe using a three-way stopcock. Action during product use. Umbilical catheters need to be secured, at least as well as adult central venous catheters, but currently there's no reliable way to do so. So the catheters are inserted perpendicular to the body and goes through a piece of tissue that needs to dry out over time. Other products start or stop. Angioplast is another device in which the umbilical cord is cut off and the healthcare provider can find these blood vessels. Once the catheters are in the right position, they are held in place with a silk thread. Sometimes the catheters are taped to the baby's belly area. Duration of use is until the completion of the procedure. Things to avoid compacting. When the catheter can migrate sometimes within the baby's body, which is a huge concern, and it happens in one third to one half of the cases. It can lead to serious complications such as cardiac tamponade and necrotizing enterocolitis. Critical clinical processes. Clinical process is a set of interrelated or interacting healthcare activities which are performed for a subject of care with one or more health issues. Our device LifeBubble is committed to designing products that solves problem in neonatal care. It revolutionizes the umbilical catheter protection and securement to improve the safety for neonates in the intensive care setting. Thank you.